I think that laser cannot substitute surgery, but laser can allow us to have very good results on some diseases that otherwise cannot be treated. So I think that when our target is the brown color, with the red color, lasers are perfect. And also because in the last 10 to 15 years, the non-surgical procedures, means the minimal invasive procedures, increase a lot. People do not want to stay outside the social life for a very long time. And so they want to come to the office, do the procedure, naturally have the result, but then they want to go back to their social or normal life as soon as they can. So that's why I think that laser will increase a lot in the next future. It depends on the season. Naturally, when the summer is approaching, leg pains and fat reduction. But the fat rejuvenation is probably, considering 1 full year, the most popular procedure performed. IPL targets the melanin and the hemoglobin, so the red and the brown color. And they can determine a very good superficial rejuvenation, while the erbium glass, the 1565, the resurfax, is affecting the water, and so it's going deeper, and we can have an improvement of the skin texture. So we can have an improvement of colors, brightness, luminosity of the skin, and we can have new collagen production. The Nd:YAG is the 1064 nanometers, the long pulse Nd:YAG. Is the laser able to go very deep inside the skin? So when you have deep vessels, it's the only one able to reach that target, and so the only one able to coagulate vessels. So I do not think that there are other lasers able to go so deep. So for vessels, is a very, very good one. There are many Nd:YAG on the market. I love the Nd:YAG from Luminase because I started to use it many years ago, and now I can coagulate in big vessels as well as smaller vessels. So I have very, very good results. I do not know what to answer because on one side, laser now produced by good companies are coming out with very safe settings. So what the companies are suggesting are very safe settings. But naturally, it's like having a Ferrari in your hands. If you are not a good driver, you can go towards a wall. Okay, and the risk for patients can be very high if a good laser is not properly used. On the other side, because the laser field is so big, and laser procedures are so common, started to appear some products coming from the east part of the world, China and so on. And the problem is that that laser are not safe by themselves. So on one side you can have good devices but not good operators. On the other side you can have also non-good laser. So I suggest patients, that is my message, I suggest patients, please go to a skillful doctor who is using very good devices. That is the best thing I can suggest you. Learn, and again learn. Means having a laser in your hand is not switching on the device, use it and switch off. You have to understand the depth you are going, the pulse duration, the energy you are emitting. So the only thing I suggest them is to go to good courses. When they have a minimal skillful, when they started to use them, maybe visit a good doctor to better understand how you can use that single device. And this is the proper way for doctors to do their best. Absolutely never. When we are in meetings, or for example, if you are speaking for acne scars patients, okay, it's a very common disease. The satisfaction rate of doctors is one, and the satisfaction rate for the patient is another. I know where I can go, and if I reach that point, I'm satisfied. But the patient suffered because of acne, scars. And so when they heard the term laser, they think, oh, maybe I can completely fix the problems. It is not true. So there's always a difference. And our job is to try to reduce the distance between the real results and their satisfaction. Naturally, I cannot say no. Doing a lot of procedures per year sometimes happen. I use a lot the pictures because sometimes they forgot how they were before the procedure. So I show them the pictures before, and so they said, "Oh, I understand now." Sometimes there are other patients that they will never be satisfied. They always want something more. But usually, laser procedure, very well conducted, give you good results. The secret there is not the procedure. The secret there is the selection of patients. It's the first consultation, the secret, because you must decide the right procedure, with the right settings, for the right disease, on the right patients. So if you are able to select the right patients, with the right device and the right settings, you will have good results, and those the patient will be satisfied. Naturally, if you are not so focused on what to do, when to do, and so on, maybe you can have more unsatisfied. The most common mistake they do is, I do one shot, I don't see anything, and so my brain is saying, oh, I can increase the energy. That could be a big mistake. Considering I choose the right wavelength, the right device, and so on. But I don't see anything, and so I say, why not to increase the energy? No, there are other settings you can change, allowing you to obtain good results. So again, I think that only learning how to properly manage a device, you can decide what to change if you do not see anything. And sometimes not seeing anything during the procedure doesn't mean that you will never see anything. Maybe you cannot see nothing, you can see nothing now, but you can have very good results after a few hours, weeks, or months. Where to go as depth, which wavelength, how I can reach that target, the right amount of energy with the right pulse duration. That is the principle they have to follow. But the most important one is where our target is, as that I'm speaking, which are the correct wavelength to reach that target. And so that means the device, that means the pulse duration, that means the energy, how to deliver energy to the skin. So these are the principles the doctor has to follow. I'm speaking about Italy, okay? And we felt a lot the crisis, the economical crisis. And what the big companies did at that time was to fire the engineer. So I am not sure we will see a lot of new things in the next years. But I am also sure that the non-aggressive procedure, minimal invasive procedures, will be the future. So I think that the field of laser and laser energy-based devices field, so it is much more complete definition, will be the future. Procedure less aggressive, naturally effective, with very high safety profile as well. That's how the trends there. Now what I can say you about tightening effect, body contouring, naturally rejuvenation of the face, that is the very common field.